Welcome back to What the Dutch. I'm Dutch Rojas, your host. Sometimes that's unfortunate. Today, it's good for you. I'm going to teach you something. We're going to dive into a topic that might sound like it belongs in couples therapy, reconciliation. But no, we're not talking about mending relationships here. We're discussing one of Congress's most powerful tools for passing budget-related legislation. Understanding reconciliation is key if you care about healthcare reform, and you know I do. So let's start with the basics. What is reconciliation? Well, it was created as part of the Congressional Budget Act of 1974. Congress realized it needed a way to align spending and revenue targets without getting bogged down into endless debates. Enter reconciliation, a fast-track process that bypasses the Senate filibuster. Here's how it works. Step one, Congress passes a budget resolution. Think of this as the blueprint that sets targets for spending, revenue, and national debt. It's like the skeleton of a building. You need it before you can add the details. In step two, the committees get to work. Each committee is given specific instructions, like saving a certain amount of money, addressing specific budgetary issues. They draft proposals to meet those targets. Step three, all of those proposals are bundled into one big reconciliation bill. And here's the kicker. It only takes a simple majority in the Senate to pass. No filibusters, no drama. It's like hitting the fast forward button on policymaking. Now, why does this matter for healthcare? Because reconciliation is often where the big moves happen. Medicaid expansion, Medicare reforms, and the ACA subsidies all were hashed out through reconciliation. But here is where it gets tricky. Reconciliation isn't just a tool for progress. It can also protect really bad policies. Case in point, the ACA's moratorium on physician-owned hospitals, effectively making ownership of hospitals illegal for physicians. This rule, tucked into the Affordable Care Act, bans doctors from owning and expanding hospitals that accept Medicare or Medicaid. Why? Not because it improves patient care or reduces expenses. It exists to shield large health systems from competition. And that's a problem. Physician-owned hospitals consistently outperform their larger counterparts. They score higher on quality and patient satisfaction and cost efficiency. Why? Because when doctors are in charge, they're focused on patients, not bureaucracy. So why is this moratorium still in place? That's a question for your representative. Reconciliation could be the key to undoing this poor policy, but it takes advocacy, awareness, and action to make it happen. Now, what do you think? Is reconciliation used effectively? Or is it a missed opportunity that healthcare advocates can take advantage of? Let me know your thoughts in the comments. And remember, this isn't only about policy. It's about people. It's about ensuring that patients get the care that they deserve. Thank you for tuning in, and stay tuned for more insights on how we fix healthcare together. Rojas out.